So there are a number of different fecal testing methods that can be employed in an effort to diagnose an intestinal parasite. And certainly historically, the gold standard has been the centrifugation fecal flotation, using appropriate fecal flotation of the appropriate specific gravity. That being said, doing a proper and comprehensive centrifugation flotation can be time-consuming and does require a significant amount of technician skill and patience to actually detect those eggs or ova in a particular animal. And in light of that fact, there has been a shift towards the implementation of antigen-based testing that does have several inherent benefits over the routine fecal centrifugation flotation. And if one looks more specifically at the antigen testing itself, the biggest benefits are the fact that this is a relatively clean and easy procedure to do by the reference lab. The benefit being the veterinarian or the owner can submit a specimen to a reference lab that can then perform a very sensitive ELISA test that can pick up different parasites. At the moment, the antigens that can be detected are those specific for hookworms, roundworms, whipworms, and Giardia. And the other important benefits that should be emphasized for antigen-based testing are the fact that the antigen-based test can pick up a pre-patent infection. So there's a window of time that a fecal flotation will be negative where the antigen testing will be positive. And this can vary for up to 3 or 4 weeks, depending on the parasite. In addition, the antigen-based testing is specifically looking for antigen associated with the adult. This is not an egg-based test. But if one does have a unisex infection, or if one has intermittent shedding of eggs, the antigen-based test will also be superior in that capacity. Now, in a perfect world, if one had the magic wand, one would want to combine the centrifugation fecal flotation with antigen-based testing, because there's no argument that these two tests are synergistic to one another. There will be some discordant results with each of these two testing methods when combined, but that being said, if one was looking at a single testing method that's highly efficient, highly sensitive, performs well in the lab setting, then fecal antigen testing certainly is here to stay and does have tremendous attributes that we should be aware of. So if one focuses further upon the different methods for detecting intestinal parasites, we mentioned before that the centrifugation fecal flotation is the current gold standard. And many veterinarians in private practice, though, will employ a gravitational flotation method. And unfortunately, that particular method is fraught with limitations. And it's been well published in both the human and veterinary literature that the gravitational flotation method is about 8 times less sensitive compared to the centrifugation flotation. So if a veterinarian is assessing a canine or feline patient that has a relatively low parasite burden, they run the risk of a false negative test result when utilizing the gravitational fecal flotation. And so that's a key limitation, and that's the main reason why we do not advocate the implementation of the gravitational flotation method. That's one of the other important benefits of implementing antigen-based testing, because that method is vastly superior to the gravitational flotation method that is somewhat antiquated. Now, in a perfect world, we would all be performing double centrifugation flotations, but that's just not realistic. And in fact, even for the large reference labs, this is a time-consuming, laborious method that does require tremendous skills for the operator. And that's another reason why the shift to antigen-based testing is being relatively well received, and publications to date have shown very similar performances between the antigen-based testing and the centrifugation flotation methodologies.